Today let us discuss about the from tongue onwards. So here the parts of the tongue. The tongue is a muscular structure which helps in the mastication, cleaning the mouth and all. So let us see the parts of the tongue. Here above the tongue, epiglottic region you can see from the picture, and lateral glossoepiglottic fold you can see, and below that one tongue lays. So here certain parts are present here in the tongue. The root of the tongue which holds the tongue, that is called as the root of the tongue, and above it you can see the nodule structures, the bumps that are called as the lingual tonsils. And below that one, a V shape you can see, that one is terminal sulcus of tongue. Terminal sulcus of. My dear students, the tongue is covered with the four types of the papillae. That means the projections, the mucosal projections above the tongue is called as the papillae. These papillae are four types. One is filiform, fungiform, circumvallate and foliate. Mainly you can see the vallate papillae and foliate papillae. The foliate papillae lies laterally, whereas the circumvallate papillae lies just below the terminal sulcus of the tongue, which is the V shape. You can see here it is mentioned the part. So these two are mainly functions in the absorption of taste. That means these are having taste buds. Foliate and circumvallate papillae are having taste buds structures. Taste buds are there in these only papillae, and remaining papillae are lies in between the tongue. So these are all the main parts of the tongue. And the tongue is a large muscular organ that occupies most of the oral cavity, which lies in the oral cavity and occupies most of the space. The base, it is attached to the hyoid bone, a small bone which lies just above the tongue, and this tongue root goes and attached to this bone. And the tissue by the fold of the tissue called as the frenulum to the floor of the mouth. My dear students, if you lift up your tongue, there is a fold you can see, that is called as the frenulum, the mucous fold, and a groove called as the terminal sulcus. The groove, the V shape I have shown you the previous picture, that is called as the terminal sulcus, which divides the tongue into two parts. The tongue into two parts, left side and right side. Even on your tongue also you can observe this one. And anterior, in front of it, is covered by the papillae. Okay, these papillae contains the taste buds, and posteriorly contains the lingual tonsils, the lumps, the lymphoid tissue I have shown you in the previous picture. Now let us see about the teeth. The teeth are embedded in the mandible and maxilla. So the above, you can see from the picture, the above bone, that means upper jaw bone, is called as the maxilla, and lower jaw bone is called as mandible, my dears. So here the teeth are embedded, that means implanted in these two bones. So the movement of the mandible, lower jaw, allows chewing. The mandible is the only movable bone in the jaw. So if you observe here, the maxilla upside bone does not move, but whereas the mandible, the lower jaw, can move and help in the process of chewing the food. And there are 20 temporary teeth. The children's after the age of 6 months, teeth eruption starts, and before 3 years they are having primary teeth. These primary teeth are 20 teeth. These primary teeth also called as temporary teeth, because they will fall down and erupt back. And later 32 permanent teeth we can see in the elders. Okay, so in these teeth are divided into 4 categories: incisors, canines, premolars and molars. My dears, the front 2 teeth are called as incisors, and beside of those 2 teeth, you can observe by touching by your tongue your own teeth. The sharp ended teeth are called as, on either side of the incisors, canines. And after the canines, premolars, two pairs are there on either sides. And after the premolars, molars. That molars are also called as grinder teeth. Grinder teeth. From this picture you can see the incisors, so the central incisors, lateral incisors, premolars, molars and canines. Now let us see about the teeth, my dears. The teeth is composed of the crown, neck, root. The crown is covered by thin but hard enamel. See the white structure you can see here, that is called as the enamel, the crown in another name. The root is covered with the bone like cementum. So I will show you the parts one by one. First we will see the content, and which secures the teeth in its sockets, and peridental ligaments holds the teeth in the alveoli, the bone which is on either the maxilla or the mandible. Okay, blood vessels and the nerves enter the tooth through the apical foramen. So the tongue and tooth are important for the proper mastication. Mastication is known as the chewing of the food, and also for speech. The teeth are helpful in the speech. Without teeth, the articulation of the speech cannot be achieved. Even the tongue also helps in the articulation and also the speech. This is the cross section of the teeth. You can see here the white structure is called as the enamel, and the gingiva you also called as gums, the muscle which supports the teeth above the root, and the dentin. Below the enamel, the white layer dentin lies. So here the tooth pain or toothache comes when this enamel goes off, my dear, by the bacterial infection or tooth decay, or by using the hard brushes. If you use for a long time hard brushes, and this enamel washes off, and that's when this dentin gets exposed. This dentin is very sensitive place, my dear. Under this dentin the nerves are, you can see here the nerve roots, even the blood circulation present. When these nerve roots are exposed to the outer air or cool water, hot water or sweet, the zoom feeling you feel. Because of this one, when your enamel washes off and this dentin exposes to the outer atmosphere, then your nerves will feel the sensitiveness. That's how we should not use the hard brushes. And below the dentin you can see the pulp cavity. The pulp cavity which is having the nerves as well as the blood vessels. Below the pulp cavity you can observe the cementum, which adheres the pulp cavity to the root canal, and also the peridental ligaments. The peridental ligaments are helping this tooth to be in the position by attaching the tooth to the alveolar bones, the bone which lies below the socket. The tooth socket bones are also called as the alveolar bones. This is the cross section of the teeth, and the main parts of the teeth as we have studied is the crown. The upper portion is called as visible portion, crown. The below the gums, beneath the gums, that are called as neck, and after the neck root is there, because the total root canal vessels parts are there in this region. Next part is the pharynx. The pharynx, it connects the oral cavity anteriorly and it continues with the esophagus. Food passes from the oral cavity to the pharynx, then the esophagus below. The pharynx consists of three parts, my dears: nasopharynx, oropharynx and the laryngopharynx. pharynx. What is the purpose of the pharynx? It prevents food from entering the nasal cavity by soft palate and the lower respiratory tract by epiglottis. So, by using the soft palate, it prevents the food into the lower respiratory tract by the help of the epiglottis. This is the anatomy of the pharynx, my dears. You can see part here which is connecting the pharynx is the tube like structure which connects the nasal cavity and also the esophagus. The upside part is two parts are present, nasopharynx and oropharynx, the pink color and the green one. And the larynx, you can see here the mixed colors are present here. The larynx, that is called as the larynx, which is connecting the nasal cavity as well as the esophagus. Next is the epiglottic region, my dears. This epiglottic region is above the larynx. Larynx is the part just in the respiratory system. So here the epiglottis is the plate like structure. Here you can see that when we are swallowing the food, it closes the respiratory tract below, not to enter the food into the respiratory tract and causes the aspiration. Next one is the anatomy of the esophagus, my dears. So this is also called as the gullet. Esophagus, it is an organ through which the food passes from the pharynx to the stomach, as we have discussed already, aided by the peristaltic contractions or peristaltic movement, that is wave like movement, which is caused by the muscular contractions. This length is about 25 centimeters long to 2 centimeters in diameter, and it lies in the medium plane, that means mediosternum. In bit means like behind the sternum, it presents along with the sternum, so that is called as mediosternal plane. And in the thorax, in the thoracic region, it lies. And in the thorax, so anterior to the spinal, it is like anterior to the spinal column and posterior to the trachea. You can see here the trachea, the white color one is trachea, the red color one is aorta, and the back of the shaded, the lines one is the esophagus. Now the constructions of esophagus, nothing but the parts of esophagus. The esophagus follow the curvature of the vertebral column. How the vertebral column is curved, in the same way the esophagus also curved. So according to that curves, it has three parts or otherwise three narrows, three constrictions, where the adjacent structures produce impressions. Okay, where the adjacent structures means nothing but the spinal column gives the impression to the esophagus. So here the first one is the cervical constriction, the upper esophageal sphincter. The cervical constriction present at the cervical region of the lumbar spine. And the thoracic is also follows the thoracic region of the spine. And the diaphragmatic constriction, the diaphragmatic constriction, where it passes through the esophageal hiatus of the diaphragm. The diaphragm is the thin layer muscular structure which covers the abdominal walls and also separates the abdominal cavity from the thoracic cavity. From it is having a knot from where this esophagus goes or enters into the stomach. These are all the parts: cervical part, thoracic part, and abdominal part, or diaphragmatic part, you can say, where it is entering through the diaphragm. That layer, the muscle is the diaphragm.